What about, I don't know what type of scan this is, but I don't know. All over my Instagram
The
are
MRI?
maybe MRI or something thermal where it's showing where the
Yes.
filler is even after years. And you hear from plastic surgeons who are like,
Yes.
oh, I did a facelift and there was all this filler.
Yes.
So we do know, right, that it doesn't necessarily go away like we were once told it did.
Right.
So how do you navigate that?
Yes. And so just this week, someone came into my office for lips, and she came in and I walked into the room, and I'd never seen her before. And I immediately could go 1, 2. I knew exactly what she had done, right? Which already is not our aesthetic or my aesthetic. She had big volume of cheeks. She had that long hanging lip with a lot of filler in it. And I said
I
to
used to
her,
have that.
no, you didn't.
I pre-lip lift, yes, because I was trying to change the shape of the lip and shorten the philtrum with filler. I mean, it was bad,
It wasn't that bad.
really bad. I'll throw up a picture. It was really bad.
I've seen. So, right. You have never taken a bad photo ever. So I sat down with her and I said, I know this is why you're not here, but I cannot put filler anywhere in your face. I need to actually remove it. So those conversations are never fun for the patient to have because they think they're going to come in. She obviously saw herself in the mirror and thought that she needed more lip filler. And here I am, she's never met me before, and I'm telling her, no, and I need to take out what you have because it's not placed appropriately or it's just been there too long. So I think that normalizing those conversations is a good place to start. We know that filler does last longer. There's so many different fillers on the market. Some last longer than others. Some are more cross-linked. It also depends on how it's placed, where you place it. There's that MRI scan there's two different camps. There's some people that find it to be very helpful, and there's some who are saying it's completely, it doesn't represent what's really happening under the skin. And I think he had good intentions of it. And this is my problem with all of the noise on social media is it's causing a lot of decision paralysis for women. And you're seeing mostly plastic surgeons. There's one guy who's in the West Coast, and he's actually a dermatologist, but is doing surgery. And he's one of the bigger, louder voices about it. And they're only talking about complications during surgery if you've had filler or Sculptra. And while I think those are important conversations to have as a society and as colleagues, it's not fair to have that conversation about surgical complications and only talk about it if you've had filler or Sculptra. Surgical complications can happen regardless of filler or Sculptra, and they're known. You can have an incisional complication. You can have nerve damage. You can have unsightly scars. You can have infection. Fat transfers are wonderful, but they're not benign. You can get fat necrosis. And when you get fat necrosis, it can be devastating. So
Is that like when someone gets a cyst?
they can have a cyst, or the fat can die and causes a local infection that then causes a massive inflammatory response. You get an indentation where that was, and you get hyperpigmentation. And of course, you can have a risk with filler as well, but you can't talk about all these complications and not have the full conversation with people. And I think that's my problem is let's talk about complications from anything we do, but you cannot blame Sculptra and filler for your surgical complications and not go back, like we said, to basics, which is what we know that you can have incisional complications. I had a surgical complication that was not in an area that I have anything in my face. And it's just a known thing. I had an incisional complication. It took months to fix.
Another surgery, right?
Another surgery, lots and lots of steroid injections. And listen, I take responsibility, right? I had informed consent. I was well aware of the complications, but it had absolutely nothing to do and not in an area where I have even Botox. So I think what happens is when you start scaring people on social media about if you get Sculptra, you're never going to be able to get a facelift, or if you do, you're going to have nerve damage. that's not fair because then women don't know what to do. And then they're terrified. And so they're waiting. It's kind of like, I always use the analogies of like eggs are good, eggs are bad. Remember like we would like eat half an egg, not the egg yolk, only ate the egg white. Now we're back to eating eggs. It's like the same thing. It's like, okay, but then what do you want women to do? Not to do anything? Not everybody wants surgery at any point in their life. Not everybody can afford surgery. And not every surgeon is talented, unfortunately. You know, like my husband's a physician. He probably could have become a plastic surgeon. You don't take a test on whether or not you're a good artist to be a plastic surgeon. John can't even see colors. And like I wouldn't trust him to do Botox in like a simple area in my face. And like, but he could have legitimately become a plastic surgeon. So just because you do the training doesn't mean that you're an artist. So it goes back to just because you can doesn't
We know he's
mean
listening
you
to this
should.
too.
Of course he is. Of course he is.
Sorry, John.
Sorry,
Not
John.
the shout out he wanted.
No,
on
but
the
it's,
show.
at least it's truthful. Even like he'll do my PRP. I'm like, that's too deep. That you're hitting my bone.
Oh God.
It's the cranium. Yeah. So like, that's the thing. And I think that what's happened is 10 years ago, there were no med spas. You had to go to your dermatologist or plastic surgeon to get your injectables. And cosmetic surgery or plastic surgery wasn't as common as it is now. And now they realize they can charge an extraordinarily amount of money for plastic surgery. So they don't need to be sitting behind a bed doing injectables. They can take that Friday off and go on their boat or do whatever they want to do. So they're not doing injectables anymore.
Sounded personal.
Oh. No, it wasn't.
I know. No, there's a few people that could apply to.
I was thinking about a different person. Everyone's like, what? They're Delulu. So because they're not doing them anymore and they want to have the surgical business, this is the angle that they're taking on social media is surgery is the only answer. Fillers don't help you. They make things worse. They make you look puffy. They make you look old. Sculptra is awful, all of the things. And so I think when you peel back the onion and you see who is making those statements and why they're making them, it'll make a little bit more sense. And the interesting thing is in my office, we get so tired of hearing about it and the fear mongering. We called some of these plastic surgeons' office and they actually offer filler, Sculptra, and Threads in their office. They have somebody else doing it. So,
Consider the source.
Consider the source. And like, if there really are things they're seeing during surgery, then let's talk about it as colleagues, because I want to do everything to set my patients up for success in the future. I would never do something that I thought was going to cause them issues down the road. And if I need to rethink how I do things, then let's talk about it as a group. Let's not scare people on Instagram that if they get one syringe of filler, they're going to look like that girl who had the car accident yesterday.
Mm-hmm.
They're just not. And like, it's so funny because like in my office, I see everybody back in 4 weeks after we do filler. Everybody, unless they fly in to see me, but then I'll see them virtually, but we see everybody back. And when they walk in, we're all at the front desk going, oh my God, you look amazing. Like you look so good. And they really do. And I think that that's the take home message, that find somebody who you like the way their aesthetic looks. All these before and afters on Instagram that are wild, you don't want to see that provider. The before and after should be subtle. They should not be something that you're like, whoa, because that's not going to look good in real life. Find a provider who has an aesthetic that you like. Work with them. Small baby steps over time give you nice, good, long-lasting results. But you have to be committed to do all the things. You can put a ton of filler in your face. If you have bad skin, you're still going to look old. You can have tons and tons of wrinkles and want filler, and it just doesn't look right. So you get to a place where you're over, 30, and you can't just do lip filler.
Mm-hmm.
You need to be doing all the modalities. You need to be doing skin. You need to be thinking about lasers, maybe a microneedling. You need to be sleeping, eating well, maintaining your weight, all of the things. And so it's expensive and I get it, right? And it's my job to make a year plan for somebody and say, this is what a year looks like. I need a year to get you to where you want to be. You don't have to get all the syringes of filler today, but I think that you need chin and lips. And it's not my job to turn people away if I'm not going to do them harm, if they don't have the pocketbook to do it in one day. Because I think that it's my job, because I know that I do a good, safe job to meet them where they are, opposed to going, you need to go somewhere that you can afford and not me. Now, if I'm not going to do harm and they came in for lip filler, I think they need added chin. We'll have that conversation. We'll put it in the plan. If I can safely do their lip filler, that they're not going to look crazy, I'll do it. And then usually the trust begins to build. You build that relationship. You start doing small tweaks over time, and then you get a beautiful, natural, long-lasting result. And most of my patients that see me are on maintenance, and they're coming in, every 3 months for Botox. They do 1 or 2 skin treatments a year. They're doing their at-home skin routine, which is so important. They've adopted some of the supplements that I think are non-negotiable, glutathione, vitamin C, which they're staying out of the sun. They're doing their best to rest when they can, and they look amazing.
Mhm.
And most of them have some sort of filler or sculpture in their face if needed. And when the time comes and I can no longer serve them with my non-surgical devices or tools, that's when we have the conversation about surgery. And again, that is a personal choice. Not everybody wants to have surgery. There are people who are adamantly against it. And I still need to care for them and support them and find creative things to help them. And I think that it's narrow-minded, and I think that it's kind of short-sighted to be like, well, filler can't help anybody.
Mhm.
I can blend filler to make it smooth in different areas. There's all these things that we can do. So I want people to kind of put that noise behind and just find somebody that you trust.